Hi, I'm Tori Caleb, and my teaching lesson is over hypertension and heart disease. My first learning objective would be for my students to understand what hypertension and heart disease is and be able to explain the specific statistics that are directed towards the African American population. My second learning objective would be for my target audience to be able to identify like the major health risks and factors that could possibly increase hypertension and or cause heart disease. And my third learning objective would be for my students to be able to promote a change in their personal lifestyles from unhealthy to healthy behaviors and activities. So in my first slide, I would ask the question, what is hypertension? And I would expect my students to be able to say the most common: high blood pressure, and pretty much that's what I would expect them to just know, that hypertension is related to having high blood pressure. My second question would be, what is heart disease? And I know that most people, when they hear heart disease, they think of heart attacks or strokes or any problem pretty much with your heart and arteries, and that's what I would expect my students to answer back. And then I would explain to them that hypertension is high blood pressure when your blood pressure is 140/90 or above, most of the time abnormal high blood pressure. And then I would tell them that heart disease is generally refers to conditions that involve narrowed or blocked blood vessels that can lead to a heart attack, chest pain, or stroke, or other heart conditions such as it affects your heart muscles, your valves, the rhythm of your heart. All this is considered forms of heart disease. I'll go to my next slide, and it would just be facts and statistics. First statistic is 1 in 3 adults are affected in the United States with hypertension. This can lead to heart disease, which can include severe chest pain, heart attack, heart failure, and stroke. So that's 80 million people with our population now that are affected with hypertension. The next image on my slide would be just to show, since my target audience is African American population, the prevalence for hypertension in the African American race. And on the chart it says that it's 36% prevalent in hypertension, which is the highest bar out of all the races, which is white, Native American, Hispanic, Asian American, Indian. And I would just go on to tell them, compared to non-Hispanic white population, African Americans are 30% more likely to die from heart disease. In the United States, African Americans are at twice the risk of having a stroke and have the highest rate of high blood pressure, which are both major signs of heart disease. There's another image on that slide, and I would just explain to them that African American women are more at risk for heart disease than any major ethnic group in the United States. Also, which I thought was interesting, is they are up to 60% less likely to receive aggressive diagnostic testing. So they could possibly have hypertension or heart disease and they're less likely to know till it's really negatively affecting them. I'll go to my next slide, and it just lists factors that increase chances of heart disease. And family history, overweight or obesity, being physically inactive, sodium intake, age, race, stress, and other diseases or health complications. And also, I would point out to my audience that new research suggests that mental health is now playing a role in heart disease. There was a study done that found that depression and anxiety and stress considerably raises the risk of death in patients with heart disease. In addition, with other risks such as smoking can raise the risk of heart attack and strokes, uh, obesity, an unhealthy diet, harmful use of alcohol, and physical inactivity. And the next slide was just some images of the unhealthy behaviors that could increase the risk of hypertension and heart disease. So that's the ones I just listed. Next slide is prevention. So with prevention, if you watch your sodium intake, you maintain your weight, you increase physical activity, you maintain your alcohol intake, decrease smoke and tobacco use, you have a good stress management, can balance work and life itself, and also having plenty of potassium in your diet. And then the next slide is just healthy behaviors, some images of healthy behaviors. Just got fruits and vegetables, eating less salt, some examples of physical activity, biking, jogging. And my next slide is lifestyle and habit changes. So for my first lifestyle change, I chose blood pressure monitoring. That is pretty much the first step in prevention for hypertension and heart disease. If you do your regular examinations, your regular at home, you can do the blood pressure monitoring at the house, or I've even been to Walmart and seen the machines where you stick your arm in and do it. If you take it upon yourself personally just to keep an eye on your blood pressure, especially being an adult about 25 or over, African American, when you start checking that and making sure your blood pressure is on what it's supposed to be, you're not too high, that's one habit change that could prevent people from having hypertension, knowing that, okay, my blood pressure has been going up the last time I checked it, so let me figure out what I need to do to decrease that. My second lifestyle change was regular doctor visits and appointments. In the African American community, I was reading an article that said we're less likely to actually go to the doctors unless we're actually in pain or something is physically wrong with us, which shouldn't be the case. With steps for prevention, you should go and do regular scheduled appointments, just checkup appointments, even before there's symptoms, because we might not feel anything and the next day you could have a heart attack. If you would have went to the doctor, they could have checked blood pressure and things, heart rate, things like that, to prevent it from getting to the stage of heart disease. And like I said, the just secondary prevention would be screenings and examinations for an early diagnosis, especially for African Americans who have heart disease that is common throughout our family history. That's why we need the regular checkups and physicals at the doctor, because it could help with early diagnosis of the first signs of heart disease, or even prompt treatment that we have heart disease. Let's see what we can help stop the disease completely or prevent further problems or complications. My third habit change was relaxation, stress management. Just being able to balance between work and life and all the other extra activities that we have or we sign ourselves up for, especially this time, certain times of the year, like Christmas, can be more stressful because you're trying to get, work a lot and things like that. Just stressing is not good. Just because when you're stressed, you don't really think to take care of yourself or eat properly or sleep like you need to, or actually do the physical activity that you need to do. So that could affect your health, and you just need to find some time to actually just relax and not stress over, and just find that equal balance. Um, And for my fourth lifestyle change, it was diet and physical maintenance. Physical maintenance. And I would want just my target group to be educated on the possibilities of prevention. Just wanting them to understand and consider all of their options on how to improve their condition or even prevent it in the future. If it could cause for them to quit smoking, be more involved in the physical aspect, exercising. You don't have to be a professional athlete. You can just increase your physical activity, daily or every other day. Just an increase in physical activity at all is an improvement. Different meal planning, not just a diet, random diets or sporadic diets or just cutting out meals completely, but meal planning, changing what foods could be increasing risk factors for hypertension or heart disease, and decreasing foods like sodium or processed food that contain a lot of sodium. And even, like I said, with the newfound research on mental health, like the depression and anxiety, if need be, therapy if there is a behavioral problem, because anxiety and depression, things like that, can affect your health also. So to improve your condition, if you need a therapy or things like that, to look for that and search for that. And at my learning activity, I will split my students up into two separate groups. Just the 1-2 numbering off method, the 1-2, 1-2. Once my groups are in two separate groups, I'll have one group actually make a list of 5 physical activities that a person, an African American, can increase on a daily basis. So, for example, one of their physical activities could be walking or jogging a mile after work 3 days out of the week. So what the students in the group will write down jogging a mile. Just describing that specific physical activity would just be jogging a mile. How to perform it. Everybody knows what jogging is. You would, for each physical activity, I would want them a lot and necessary time to do that physical activity. So just estimate how long it would take for an average person to just jog a mile. So maybe 30 minutes to finish that physical activity, because you don't want it to take too long or it won't be as effective. And then I want them to list the location that the physical activity could happen. So they could say local gym or neighborhood, or for the jogging, it could be either one of those, or community center. And then I want them to explain to me how that individual physical activity is going to help with the prevention of hypertension and or heart disease. And so with the jogging a mile 3 days or 4 days out of the week, how many other days, it could increase blood flow, and increasing blood flow is good for the heart, cleans out arteries, makes the heart stronger and not as weak, to be susceptible to a heart attack or something like that. So that would just be one example of one physical activity. So the group one would list 5, so it could those specific activities. The second group, I would have them, group 2, list 5 diet habits that individuals can improve their personal lives to reduce and prevent hypertension and heart disease. When they list these diet habits, I want the name of the foods, how much of that specific food would be appropriate, if adding more of that certain food prevents hypertension, or if decreasing intake of that certain food prevents hypertension or heart disease. And also where to get these foods from. So one example could be French fries. How much of a daily intake is appropriate? Well, it depends on, we'll go with the average person. You don't want them eating French fries 3 meals every day. So with this food, you're looking at decreasing intake of a certain food to help prevent hypertension. And then I would want to know, where do they usually get these French fries from? What would be a healthy substitute for these French fries? So if they usually driving through the drive-thru at McDonald's to get these, and they're doing a supersized French fry, how about we decrease the daily intake from a supersized to maybe a medium, through the drive-thru at McDonald's, or even actually getting potatoes from the grocery store and making your own French fries, which are a little bit healthier. So that would just be one example of a diet habit or diet change for that individual, and I would need 5 of those.